Good morning, students. Today we will be covering another short note, that is levels of prevention. Now, the word prevention, the main goal of the prevention is to promote health, preserve health, whereas if there is an impairment, it should be preserving the impairment also, whereas if there is any further uh, disability, it should rehabilitate the whole thing. Now, there are four levels of prevention. First is primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Now, coming to a primordial prevention, it is a primary prevention, prevention of the emergence or development of any risk factors. Here, can see in the example that obesity will lead to hypertension. Now, if we promote that the being obese will cause you a hypertension, or being obese will cause you any further disease, by promoting at early stage of life, it can prevent from being these diseases. For example, a dental caries, if you promote that the eating a sticky food or eating a carcinogenic diet will lead to a dental caries, if you promote it in the very early stage of your life, we can decrease the growth of dental caries. It can be through individual or mass education intervention. Primary prevention can be defined as the action taken prior to the onset of disease, which remove the possibility that a disease will ever occur. It is a pre-pathogenic stage. For example, I am a host, an agent which is present as an environmental factors. If we take a proper care, if we take a proper precautions, we can prevent that host entering into our body and causing a ailment. Again, the example snacks and dental caries. If you are eating a high carcinogenic diet or you are eating a high sticky food, you can prevent it at a very early stage, or in fact at the initial stage, and thus can prevent dental caries. According to WHO, the approaches for the primary prevention of a chronic disease where the risk factors are established are population mass strategy and high risk strategy. Coming to our secondary prevention, in this the initial lesions has been developed. Action which halts the progress of disease at its incipient stage and prevents its complication. Again, it is pathogenesis. Being a host, the agent has entered in our body. Now, if we can take precautions so that the agents won't again disarm our internal organs or our body. Taking an example of dental caries, if we detect a class 1 lesion which is not causing any pain at an early stage, we can restore it with the normal restorative cements or GIC or etc. The aim of secondary prevention is to arrest the disease process, restore health by seeking out unrecognized disease and treating it out before irreversible changes takes place. Now, the disadvantage of this secondary prevention is that the patient becomes mentally anguished and he has already started suffering. There is physical pain, loss of productivity. It is though going for a restorative treatment, it is expensive and less effective than the primary prevention. Primary prevention is better than secondary prevention. Hypertension will lead to heart attack. Hypertension has occurred. Now, if you won't take a proper precaution, it may cause you the heart attack. Again, dental caries, there is pulp involvement. You can either go for extraction or you can go pulp procedure. Tertiary prevention has defined all measures available to reduce or limit the impairments and disability, minimize suffering caused by existing departures from the good health, and promote the patient adjustment to the irremediable conditions. Now, coming to the modes of intervention, any attempt to intervene or interrupt the usual sequence in the development of disease in man. Intervention is nothing to intervene or do an experiment to interrupt the usual sequence. Now, suppose there is dental caries happen, you can either go for the pulp therapy or you can either go for the extraction. Now, primary prevention, the modes of intervention in primary prevention are health promotion, specific protection. Secondary prevention, early diagnosis and treatment. Tertiary prevention, there is disability limitations and rehabilitation. Coming to our health promotion is defined as the process of enabling people to increase control over and to improve the health. The well-known intervention in this area are health education, environmental modifications, nutritional intervention, lifestyle and behavioral changes. The specific protection includes immunization, specific nutrients, chemoprophylaxis, protection against occupational hazards, and avoiding all allergens. Early diagnosis and treatment. Again, the early diagnosis is very useful. The detection of disturbances of homeostatic and compensatory mechanism, while biomechanical, morphological, and functional changes are still reversible, though not as effective and economical as primary prevention, but reduces the mortality and morbidity in certain diseases. Now coming to our disability limitation, concept of disability, there is disease, then there is impairment, then there is disability, and finally the person will become handicapped. Now coming to definition defined as a loss, or definition of impairment defined as a loss or abnormality of psychological, physiological, or anatomical structure or function. Disability is defined as any restriction or lack of ability to perform an activity in the manner or within the range considered normal for human being. Now, handicap defined as a disadvantage of given for a given individual resulting from an impairment or a disability that limits or prevents the fulfillment of a role that is normal for that individual. Coming to our rehabilitation, I'll give you a simple example. You've undergone a pulp therapy. After that, you need to go for a crown. Why? Because after doing a pulp therapy, the strength of that tooth is lost due to the treatment and due to the pulp procedure. So, if you are putting a crown on that, this process is known as rehabilitation. It is defined as a combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to the highest possible levels of functioning. These are the levels of prevention. Priorities of prevention will, in the primary phase, will prevention of disease initiation. In secondary phase, prevention of disease and progression of reoccurrence. In tertiary phase, prevention of loss of function. Whereas taxonomy of prevention, that is prepathosis, intervention, and replacement. And preventive services in primary phase will be health promotion, specific protection, and in secondary phase it will be early diagnosis and prompt treatment, and in tertiary phase disability limitations and rehabilitation. With this, we will be concluding this levels of prevention. The main goal or main approach should be the prevention. The disease which can be stopped at a very early stage will be good for us, good for the community. Thank you.